Hello, everyone. I'm Major Garrett in Washington. Welcome to The Takeout. Healthcare policy in America is one unceasing story of woe. Costs go up, access always exists on a knife's edge, and is the first concern for anyone who has lost a job. And if you are self-employed or a gig worker with more than one or two jobs, or maybe three, it's a morass of costs, plans, and high deductibles. Employer-provided insurance is a bit more rational, but far from immune from higher premiums and encroaching limitations on care. Obamacare did not solve this, but it did drive down the number of uninsured Americans. When it was signed in 2010, just under 15% of all Americans were uninsured. Last year, with 45 million Americans enrolled in Obamacare plans or through expanded Medicaid access, that brought the percentage of uninsured down to 8%. Now, the issue you've heard about for weeks, the issue that was at the center of the longest government shutdown in history, soon to expire, enhanced Obamacare tax credits. Here's some important numbers. 24 million Americans have insurance through the Obamacare marketplace. Of that, 22 million, or 92%, receive these more generous subsidies. They were passed during COVID, and they expire, importantly, December 31st. The average Obamacare exchange enrollee will, starting next year, see a $700 per year premium increase. That, according to research from KFF. This deadline, not new news. Everyone has known about it. Republicans and Democrats describe this problem in their own ways, but they use the same word, crisis. 2 Senate votes today kept the crisis at status quo. The GOP alternative, no extension of these subsidies, but direct payments to consumers, got 51 votes, needed 60. Kentucky Republican Rand Paul, by the way, voted no. The Democratic alternative, a 3-year extension of existing subsidies, also got 51 votes, also needed 60. All Democrats supported that, and interestingly, 4 Republicans. Susan Collins of Maine, Josh Hawley of Missouri, and Dan Sullivan and Lisa Murkowski, both of Alaska. That 4 Republicans voted with Democrats on this issue indicates the uneasy feeling some in the GOP have on this issue, the coming sticker shock and potential political fallout. We pick things up right there with Caitlin Huey-Burns on Capitol Hill. Caitlin, take it away.
Hey, Major. Well, you know, politics is unpredictable these days, but legislation on Capitol Hill is very predictable. And we knew heading into this vote that both of these bills were destined for failure because they didn't have the votes that they needed to get. And the policies were virtual non-starters on the opposing party's side. So you mentioned the Democrats' plan, which was an extension of those Obamacare subsidies for 3 years. It did get 4 Republican votes, as you mentioned, but most Republicans don't want to continue, in their words, to throw money at a problem. The problem, in their view, being the Affordable Care Act and how expensive it has become, in their view. Republicans want to put that money into a health savings account that Democrats call junk insurance. And so the parties are still very much at odds on what to do about a problem that they agree is a problem, and that is rising health care costs and the inevitable, which is that premiums are going to go up in about 20 days' time from now. And as all this finger pointing is going on Capitol Hill, there are very real people caught in the middle of all of this who want Congress to come to an agreement. I talked to 2 people who are on the Obamacare exchanges. One is a small business owner who relies on the program and also has 2 small children who rely on it. I also spoke to a woman who is from Virginia Beach area, and she had an accident, is in a wheelchair, relies on her health care coverage through the Obamacare exchanges to get the physical therapy she needs so that she no longer will have to be in a wheelchair. I want you to listen to how they described how they're feeling as they already are planning for those premiums to go up.
Healthcare is a complicated issue, without a doubt. I think one of my major frustrations is that no system is perfect. This is the best thing that's been offered. No system is perfect. There are going to be some people who are cheating and fraudulent, but that's not most of us. Most of us just want to be able to go to the doctor without panicking.
It's really scary. We are small business owners. We're doing well, but we're not wealthy. So an extra $300 a month has to come from somewhere. And groceries are already way more expensive than they have been. So, fewer Christmas presents, fewer luxury things like going to the movies or things like that.
Now, both of these women told me they are not expecting Congress to get around a solution by the end of the year, and they're already starting to adjust their budgets for the next year for themselves and their families to accommodate these higher prices, and they really are tightening their wallets. Now, Major, the question is what comes next, right? The House is going to put forward their own proposals next week, they say, but we don't yet know the details of that plan. And we are waiting to see whether today's vote does put a little fire under those lawmakers on the Senate side to come up with some kind of arrangement, because we did start to see today some small support for at least temporarily extending those health care subsidies. So we will see what next week brings, but we're coming close to that deadline and nowhere close to a conclusion.
And Congress will watch the President of the United States very closely to see if he decides to wade in on any of this. Caitlin Huey-Burns, thank you so very much.